This, gum recession, is different from this, wear on the neck of the teeth.
Both conditions cause tooth sensitivity. Both look bad. Both require treatment. Let's start by differentiating the two conditions. One is gingival recession. Here, the gum recedes, leaving the tooth exposed, making it look longer. This causes tooth sensitivity and is not aesthetic at all. The other problem is called a dental abfraction, better known as wear on the neck of the teeth. Here, part of the tooth comes off, usually at the neck. Let's start with gingival recession. What causes it? It can be due to poor brushing technique, excess dental plaque, periodontal disease, orthodontic treatment with excessive force or movement, iatrogenesis or professional error, habits like smoking, and also from having tongue or lip piercings, as well as other artifacts that constantly hit the gums. The root problem must be treated, of course, before performing corrective treatment. For example, you can't do gum surgery to return the gum to its place if the person still has plaque or won't quit smoking or won't remove the piercing. Once the source problem is treated, we proceed to correct the gum recession. The only way is with periodontal plastic surgery, that is, gum surgery. Think about this. What you lost is gum, so the logical thing is to replace it with more gum, not with a rigid material that creates volume where it shouldn't exist. It partially removes hypersensitivity, but that resin can in turn cause more recession, because resin is not completely compatible with the gum. Now let's look at abfraction, the famous wear on the neck of the teeth. These have a very different etiology, and the condition, although it can also present with tooth sensitivity, must be treated completely differently from gum recession. For many years, it has been shown that these types of lesions are mainly caused by excessive biting forces applied to the neck of the teeth, which is mistakenly confused with poor brushing technique. First, the cause must be treated, which in this case may be due to a bad bite or a bite with excessive force. How can it be treated? Well, it can be treated with orthodontics. An occlusal guard can also be given, those little devices you put on your teeth, to avoid excessive dental contact, and you can also resort to placing a prosthesis or resins on the teeth to modify and improve the bite. If the wear is very subjective and there are no symptoms, only the source cause is treated to prevent the wear from continuing to grow. Number 2, if there is already sensitivity and there is little wear, we proceed to seal those exposed dental tubules. Point number 3, composite resin restorations modified with glass ionomer can be used. Now, if the conditions are combined, both techniques can be used to recover the lost tooth with resin and the lost gum with gum. Knowing the difference in these conditions will give us the opportunity to correctly treat our patient's teeth. See you in the next video and take very, very good care.